Greetings. It is a pleasure for me to address this audience composed from colleagues from Europe, elsewhere, and in particular from Ukraine. I'm very grateful for this opportunity to join this series of webinars offered by multiple European organizations, including OMNI-Net Ukraine, which is an international effort with long-standing presence in Ukraine. We are called OMNI-Net, and our fundamental mission is to serve as a center of information and education. The subject today, as is well known to you, is spina bifida in Ukraine. And in Ukraine, unavoidably, that includes attention to what Chernobyl is or is not. It is self-evident that the issues related to Chernobyl are complex, including its potential impacts on embryos and subsequent developmental anomalies. In the context of the present series, our emphasis is going to be on spina bifida and what we know about it in Ukraine. Due to limitations of time, this is part one. Part two of this presentation will follow a week later and will focus on a broad spectrum of Chernobyl impacts. So please be aware that you could subscribe to part two, as we are going to indicate shortly. My presentation today will be followed by that of Dr. Sylvia Rosen, the Secretary General of the International Federation for Spina Bifida. This distinguished colleague will inform the audience about the World Health Organization resolution regarding folic acid to reduce the impacts of spina bifida, and also the critical, essential, and absolutely necessary participation of parental support groups for the success of such initiatives. Following the presentation of Dr. Rosen will be one by Dr. Natalia Zimak-Zakutnya, a director of the Khmelnytsky City Children's Hospital. This hospital is a national reference center for spina bifida, and I think our colleagues from Ukraine should pay particular attention to this feature. Dr. Natalia Zimak-Zakutnya is not only the director of the Khmelnytsky Medical Center, Children's Medical Center, but she is also the director of clinical genetics for OMNI-Net in Ukraine. As a pediatrician, she has made multiple contributions to the well-being of Ukrainian children. First, a few words about OMNI-Net and the precedents related to it. The organization of the OMNI-Net began in 1986, shortly after the Chernobyl disaster. It didn't prosper because the Soviet Union was blocking access to Ukraine, in particular to Volhynia. In 1991, Ukraine declared independence, which opened access to international experts to collaborate with Ukrainians. We were invited to make a presentation to the United States Congress, which eventually resulted in initial funding by the USAID, endorsement by the March of Dimes Foundation, and altogether, including with European organizations, we visited Kiev to create an agreement with the Ministry of Health. What it was proposed was a population-based surveillance of all newborns for developmental disabilities. This surveillance is unlimited to the categories surveyed, but in practical terms, it is focused on 111 categories of developmental disabilities. The condition was that they should be detected utilizing international standards, which were not upheld by the Soviet Union. And to measure that as fulfillment or as fulfilled, OMNI-Net had to prove that it could join international organizations, including EuroCat. We are full members of EuroCat, which is a monitoring system similar to the one in Ukraine across Europe, United Kingdom, and Ireland. Concurrently, because of the high use of alcohol in Ukraine, we initiated a collaborative investigation with the National Institute on Alcohol and Drug Abuse of the United States. So this is in short who OMNI-Net is. The central mission is to become a data resource and an information center for Ukrainians. The tactic to achieve the information dissemination of the results of the ongoing surveillance of infants, we rely on quite a few websites, icons of which are displayed here, 5 of them, there are a few more. And spina bifida is included in the contents of each of them. You are invited to visit these websites because they are accessible free of charge. For example, past webinars, including now the present, are offered through channels of YouTube, most of which are bilingual, that is, English presentations are also available in Ukrainian. Presently, there are over 196 tutorial videos, and again, you're free to visit them. The link is shown. In this screen is emphasized one of the websites I like to overemphasize. It is a website in Ukrainian about medications that may harm the unborn. For instance, anti-epileptics increase the frequency of spina bifida. This website has attracted hundreds of thousands of visitors from Ukraine, mainly pregnant women. It seems to me like most Ukrainian clinicians should know that this website exists. It's one of the unique ones in the world, and it includes the risks associated with medications that each physician may be prescribing to a woman that is not even aware she is already pregnant. For example, let's suppose we are focused on dilantin, which is one of the teratogens that may manifest as a neural tube defect. Extensive information is available in another website called International Birth Defects Information System, with the link shown below. In this website, multiple specialists can post their points of view. In this website are shown the selected and best sources of information on this subject. And we invite Ukrainians to make contributions in Ukrainian, as you can see on the right, or in English, on any subject related to developmental disabilities. Focusing on spina bifida, I think it is proper for me to inform Ukrainians and non-Ukrainians alike that in the near past, there were dedicated 10 webinars to this subject, that over 1,000 participants, active participants, were interested, and that 3 times as many viewers visited these websites post facto, which underscores the importance of making the contents of webinars available through the internet. This webinar will be recorded, this webinar will be posted, and this webinar eventually will be translated into Ukrainian, and both are going to be available in the YouTube channel of OMNI-Net. So, spina bifida, Chernobyl, implying ionizing radiation. We have known since 1929 that radiation is dangerous for babies, that pregnant women subjected to X-rays may deliver babies with spina bifida or microcephaly. We have known that since 1929 there is nothing new about it. And for those who wish to know facts more accurately, here is what a Dr. Murphy observed in 1928. He investigated 53 women exposed to in-utero irradiation. Among these 53 embryos, 27 had small heads, microcephaly, and 13 had spina bifida. There is nothing new. Also, however, this is an emblem of an enormous public health victory. In a very short time after this discovery, the medical policies introduced the warning that pregnant women should not be exposed to radiation. A victory of the ethics and responsibility of the medical profession. But is Chernobyl radiation? Should pregnant women be exposed to Chernobyl radiation? We'll talk about it. The International Agency for Atomic Energy, which automatically is endorsed by the World Health Organization, considers that that's not relevant, that Chernobyl could not possibly be a cause of spina bifida. Such statements are not supported by investigations in Chernobyl areas that were impacted by Chernobyl areas. So, why not Chernobyl? Is it just a hypothetical, theoretical position? Yes. OMNI-Net was created for many reasons, but among them was, does Chernobyl cause developmental disabilities? Yes or no? And that includes spina bifida. Here is a map of Europe and all the network of EuroCat, of which we are full members. This adds credibility when we monitor disabilities in Ukraine the same way like in Paris or Berlin or London or anywhere else. I think it's important to underscore that spina bifida in Ukraine, its frequency is elevated above all the other areas in Europe. Sort of a provocative contrast. The following observations of thousands of patients and thousands of women who underwent measurement of their incorporated radiation would not have been possible, and therefore we must acknowledge with gratitude most healthcare professionals in Rivne who voluntarily participated in our efforts. Furthermore, this was made possible by an endorsement of the Ukrainian Ministry of Health and contributions of a large host of international experts. Thank you to all of them on behalf of all members of OMNI-Net. So let's look at some facts, not hypotheticals. In Rivne, there were 320 infants with spina bifida, representing about 5% of those across Ukraine, meaning that in Ukraine there were about 6,400 infants with spina bifida. That is not a small number. That is an epidemic. Neural tube defects, to which spina bifida belongs to, were observed in 542 infants, representing at 5% frequency in this province of 10,800 in Ukraine in general. Well, let's look a little further. Spina bifida and polyscia, the frequency based on a population base, that is among all Ukrainians, all Ukrainian infants, that is, represented 12.6 cases of spina bifida among 10,000 births, much more frequent than in North Polyscia, which among 10,000 births was about 8.67 births. And in Europe, among 10,000, there were infants with spina bifida born about 5 times in 10,000. Why? Ask why. And can it be reduced? Answer, absolutely. The frequency in Polyscia and North Polyscia should be less than 5, because it is lower in countries that fortify flour with folic acid. So, fact 1 is hardly disputable. Spina bifida is highest in an area polluted by Chernobyl. Well, maybe it is due that the women drink more there, and therefore that's why you have it. They worry about the radiation in Polyscia, so they drink. No, but actually, when you measure pregnant women and how much in their body is their cesium-137, you see it is 3 times higher than in North Polyscia. Each molecule of cesium-137 explodes in that mother, explodes inside of that embryo, and causes damage. On another perspective, while some women eat more radioactive cesium than others, women that love to eat mushrooms may have more incorporated cesium than women that don't. So here is another statistic. Women that have over 100 becquerel explosions per kilogram of their body weight, 382 in Polyscia compared to only 8 in North Polyscia. What kind of babies are they going to have, these 382 pregnant women? How many of those babies are going to be dead? How many will have spina bifida? Is that something we don't want to know? Ask yourself. So we come back to the same question. Women should not be exposed to radiation, whether they know it or not. They may be pregnant. In fact, you should not be exposed to radiation because it's carcinogenic. But we're talking about babies, we're talking about embryos. Why not Chernobyl? What's wrong? We know that radiation will cause spina bifida and microcephaly. Why not? We should perhaps explore that further. So here are some facts. In Polyscia, spina bifida was statistically significantly more frequent. In-utero exposures to radiation of embryos was statistically significantly higher. In Policia, other NTDs, such as craniorachis were statistically significantly higher in Policia. In Policia, microphthalmia and microcephaly were statistically significantly higher than in not Policia. So how many facts do we need? And we have them. Why not Chernobyl? We're going to talk more about the why not in part 2. But since this part is focused on spina bifida, let's talk about 2 things we can do right now, tomorrow morning. It cannot be done without you. It cannot be done without Ukrainians. This is not the responsibility of Putin or any government. It is the responsibility of everybody. 1, we can reduce radiation exposures by eliminating the sources. And the sources are water and nutrients polluted that pregnant women swallow or inhale. The Ukrainian government has discontinued the monitoring of the sources of radiation for pregnant women in the areas contaminated by Chernobyl. Why? Well, they follow recommendation of international agencies. Why? Find out. The second thing we can do is to reduce the frequency of spina bifida directly. How? By adding folic acid to flour. Well, why to do that? Well, there are over 100 countries that are doing this, and you're going to hear more about it from Dr. Rosen. And they all have demonstrated that it is safe and that it is effective. Why don't we put folic acid in flour in Ukraine? Why? Ask yourself, why? So I have run out of my time. We'll continue in part 2, exactly 1 week from today at the same time. Registration announcements will be promptly followed this webinar. And I hope I see you then. But before, I have a few little things to add. So, OMNI-Net, as stated, was dedicated to science, to find out facts, and to disseminate information, how to diagnose, care, and prevent developmental disabilities. But things have changed. The change is war. And during war, OMNI-Net has to change. And the change is that we need to shift our attention to assistance, to care. And to do so, we need your help in order that we can help. We can help others, but not easily without your help. And are we doing something? Well, we are doing quite a bit, given that our resources are very limited. We are not a state institution of any kind. We have no connections to any government, and therefore our resources are minimal. But we have distributed over 25,000 urinary catheters free of charge, and pay as we may. We pay as we collect a few dollars here and there. But we cannot afford to buy cerebral shunts is sort of a halfway help. You know that spina bifida has problems with the urinary tract, and that's exactly what these websites are about. But they also have hydrocephaly. Are we just champions of a half patient? We don't want to help the whole patient, we just want to help the lower half and not help the upper half? It doesn't make sense, does it? Very often, professionals say, well, why don't you call so-and-so? Why don't you write so-and-so? Why don't you ask for help from such and such agency? Yeah, sure. We can do so. So can any of you. But the issue here is that our professional colleagues should have their own sense. They can make a personal contribution more than just recommendations. So I invite you to join other professionals, because without them, we would not exist. Help us to help others. And now I wish to thank you for your attention and invite you to see part 2. And of course, to make a personal contribution so we can continue our work. Thank you, and thank you again.